The following program is being brought to you on the Voice America Health and Wellness Channel. For more information about our network and to check our additional show hosts and topics of interest, please visit voiceamericahealth.com. The Voice America Talk Radio Network is the worldwide leader in live Internet talk radio. Visit voiceamerica.com. The views and ideas expressed on the following program are strictly those of the host or guests and do not necessarily reflect the views and ideas held by the Voice America Talk Radio Network, its staff, and management.
Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi everybody, welcome to Falling Through the Cracks. Today we're talking with Dr. Dietrich Klinghardt. He studied medicine and psychology in Freiburg, Germany, and completed his PhD on the involvement of autonomic nervous system in autoimmune disorders. He founded the Sophia Institute in 2012 and is actually involved in patient care at his clinic. Today we're going to be focusing on discussing Lyme disease. So Dr. Klinghardt, welcome to the show.
Yeah, thank you for inviting me. It's an honor.
So how did you get involved in treating Lyme disease?
Well, quite honestly, Lyme disease was known under another name in Germany because it was this Black Forest area where it came from is a heavily tick-infested area, and so all the neurologists in the area knew tick-related neurological illnesses. It just didn't have the hype around it or the public attention on it. So neurologists were coping with it, by using a variety of treatments. But that was, when I went to medical school, I had to do an internship in 1972 with a neurologist, and he could actually go in a room of 20 people. That was before everybody had their own room in the hospital, so it was more a socialized system. So you could go in a room with 20 patients and spend the 2 minutes, 3 minutes looking at the different people, and you could tell where, these were all neurological and psychiatric patients, you could tell not only what village everybody was from, but whether they were on the east slope of the hill that the city was on, or on the west slope, or on the southern slope. And he said, yes, the spirochetes that's causing all these illnesses have a great ability to mutate and to activate different genes for different expression of the illness, and he knows exactly where people are from just looking at the facial features, tiny the squinting of the eye on one side, not on the other, or the mouth hanging on one side, a little bit lower down than on the other side, and the face being nicely perfused with blood on one side, so pink, and on the other side pale. He read those signs, and it was amazing. And so I was very familiar with spirochete illnesses, and quite honestly, Dr. Burgdorfer was actually known in those days because he was at the university in Basel, which was just 40 miles from us, and he was the guy researching all the insect-borne illnesses, and he was at our psychiatric clinic, and just in the 3 months stint I did there many times connecting, and he introduced us students, to spirochetes, and of course that's years before. This is we're talking early 1970s, and then he was already going forth and back to New York, where he was lecturing, so a guest professor at the time, and so I was in contact with it early, but also the illnesses related to it, and then of course when Lyme became popular here, it was kind of a familiar turf. What I was unfamiliar with is that long-term antibiotic treatment was one option to actually get on top of it, and that surprised me, and that was a new idea And then, of course, we know that the variety of Lyme that spread from the East Coast westward had like some man-made components in it that made it much more vicious and much more deadly, than the Black Forest variety. The Black Forest variety, people got thick swollen knees, and they got, one hip joint kind of being bad. It was mostly an orthopedic expression, and some people a psychiatric expression, but we did not see the chronic fatigue and immune suppression that the American variety has, and that seems to be that there's a recombinant gene. There are some other genetic features that were acquired either in the lab or by accident on the East Coast that made at least certain types of Lyme disease so vicious. And I think we need to consider that idea more when two people have Lyme disease that test positive in a Western blot test, that there may be completely different strains of Lyme. One may be absolutely lethal and the other one may be quite harmless.
I find that part quite interesting, having Lyme myself and having been treating it for almost 10 years, that, people are so dramatically different in how they present with it, but they're testing positive. And have you seen that change a lot over the years? And what have you been observing with that?
Well, first of all, we probably get into that later, but we developed in my office this challenged PCR testing. And so, first of all, we find these patterns now, whether you have Lyme plus Bartonella plus Mycoplasma, that looks different than when you have Lyme plus Babesia plus herpes viruses. And so it's really the combination of the co-infections that makes the music. We found, that really, and other people have mentioned that for example, Bartonella seems to be much more vicious, much more dangerous in terms of invading your brain and your spinal cord than Lyme. Lyme is sort of a bug that has been around for a while, where our system is already habituated to some degree, but newer bugs that have come on board, especially the new varieties of Bartonella and Babesia and Mycoplasma, are far more vicious and create a whole other subset of symptoms. And so, and then of course there is a huge variety of immune responses that the patient has that determines pretty much whether you will have an orthopedic expression or a neurological expression or psychiatric expression or immune deficiency expression of it. There's a great variety that's kind of different from other infections. Other infections pretty much you can map out. Okay, when you have a strep infection, it may affect your heart, it may affect your knee joints, and it may affect your kidneys and your brain. So there's like 4 places where it can go to, and it could be one of them or 4 of them. But with Lyme, we see everything. It can pretty much create any known symptom, any known illness, most of them which don't have a name. I don't think this the weird kind of off neurological illnesses that we see, we can pretty much now say that every neurological illness that doesn't have a traumatic cause, like, when the parachute didn't open up and you fell into a haystack, and broke 15 bones and then have some neurological problems, that's probably not Lyme disease. But if you have the same kind of pain pattern and you didn't have an accident, it probably is. And so you cannot really, by the symptoms, you cannot really tell what it is. You have to test.
So I want to ask you more about your challenged PCR testing, and just so people listening who aren't aware, Lyme is difficult to test for, and I know that what you're doing, you're getting better results. So can you just explain how you go about doing that?
Yeah. So the original testing done in this country was done with a microscope. There was Dr. Burgdorfer, and there was Alan MacDonald, the brilliant pathologist who did all the early work dissecting Alzheimer's brain and finding in all Alzheimer's brain, not just in some living Lyme spirochetes. And he worked with a microscope. And then because the microscope work is very tedious and you can only do it on tissues where actually the Lyme bugs sit, where they are, so it's difficult to look into the brain of a living patient and kind of say, yes, you got Lyme spirochetes in your amygdala. So to get a test that works, people in this country went to immune system-based tests. That means if the cells of your immune system travel through the body and they encounter Lyme disease, so that they're informing then the thymus and other tissues of the illness, and then there should be a subpopulation of the white blood cells should be entrained to go after these bugs. And that's sort of what you're ultimately looking for with the Western blot test and with the LTT test and the other IFA, IgG, IgM, they're all tests that depend on that the patient has a functional immune system that mounts a response and that you can see. Now, the trouble with that is that the very severe Lyme patients have not mounted an immune response in 10 years or 15 years. The system has completely been overwhelmed by the infection and basically paralyzed. So there is no more viable immune response. One of the indicators that you're aware of that we are using for that is the CD57 test. There's pros and cons for this test, but it's a test that shows that Lyme manages to virtually annihilate a subpopulation of natural killer cells, of white blood cells, that are supposed to be in charge of killing the Lyme, and instead the Lyme kills those cells and they just disappear. And so, and if the cells that are supposed to secrete into the blood the very markers that we're looking for in the lab. So when we do a Western blot, we're looking for markers that are secreted in the blood by functional cells of the immune system. And so when we have those markers, great, then yes, you probably have Lyme disease. But if you don't have those markers because your immune system is exhausted and cannot produce those markers anymore, then we Lyme literate physicians know, well, that does not mean you don't have Lyme disease. It just means your immune system is not capable of mounting that kind of response. And so the sickest patients that we've seen with Lyme, with MS, with ALS, with Parkinson's, with different expressions of the illness, the sickest people that we've seen, people with severe chronic fatigue, had negative Western blots. And however, I developed a manual system of testing using certain reflexes called autonomic response testing, which I've been using for over 30 years. And with the system, be finding, especially in that patient group, massive indicators for that they have Bartonella, that they have Borrelia, different types of Borrelia, that they have Mycoplasma, and so that they have Rickettsia. And so we were looking for a better way of testing. And here's sort of the short end that I think people can follow. In chronic Lyme disease, Lyme does not live in the blood. The blood has the best immune system, and who wants to live in the tissue that's the most hostile to you? So the Lyme spirochetes set up sanctuaries. That's a proper term in medicine. Lyme sets up sanctuaries in certain parts of the brain, the spinal cord, the connective tissue, maybe in the right hip joint, but not the left one, in the discs of the spinal column, and other tissues. It is not in the blood. It occasionally strays in the blood if it gets, by mistake, flushed out by some event, by excessive exercise or by a fall, a car accident. It may be flushed out from its sanctuary into the blood, and then you can find it, and then it sensitizes the system, and for a while you may actually have a positive Western blot, and then it's forgotten again. So in order, when you actually really want to prove the illness by looking at the bugs, or at least looking at the genes of the bugs, which the PCR test is, you actually have to look for it where the bugs are, not in the tissue that's convenient. So if you look in the blood for living spirochetes, when they actually have completely infested your brain and nearly destroyed it, but they're not in the blood. And so we're looking in the blood because that's what's convenient to look at. And in the brain, we can only, like Alan MacDonald did, we can only look post-mortem. And so I just came up with the simple theory, well, let's use tools that chase enough of the bugs out from the brain or from the thyroid or from the disc into the blood, and then chases from the blood through the kidneys into the pee, because in the urine you're concentrating everything that's in the blood that's unwanted. And so based on that, we developed this test called the RK protocol, where we use ultrasound and infrared light on the tissues where we suspect where the Lyme bugs are, or with my ART testing, we already know exactly where the tissues are. Maybe the right prefrontal cortex and maybe the left temporal bone. And so we put ultrasound on those tissues. For this, the whole treatment takes less than 10 minutes. And then follow that up with a particular infrared device that costs less than $20. That increases exclusion zone water that actually pushes the bugs from the tissues where they're hiding into the bloodstream. And then we collect the urine for 6 hours, and then we have a huge yield, huge evidence of the bugs that they actually were in those tissues that we treated. And the first 150 of these tests that we did, we had 2 patients that were negative. So 148 were positive, and it was very rare that somebody only had 1 bug. Most of them had, the whole variety, the rickettsia, the ehrlichia, you name it, the whole who's who of Lyme disease. And so with that test, I hope it will become the gold standard. It's much more affordable. It's less expensive than doing the IgG, IgM test, plus the Western blot, plus all the other things. And we're testing for 14 bucks right now. And the test is about $500. So it's not cheap. But, getting 14 of the co-infections for $500, that's a lot less than the other tests. And it's tissue specific. We can take a patient that got Parkinson's. Okay, we want to know what's causing the Parkinson's. So we just put the ultrasound and the infrared light on the brain. That's it. If somebody has a bad shoulder, we want to know is this mycoplasma shoulder, a Bartonella shoulder, or Borrelia shoulder, or none of it. We put the ultrasound and the infrared light just on the shoulder, and then collect the urine afterwards. And then whatever comes out, must be from that area. Now we should always test the urine before and do the test before, so that's $500. And then we do the ultrasound in an area, it's another $500. I have to say, the lab in Colorado is treating us very unfriendly. They have not, even though we've sent them thousands of samples, I still have, even for myself, pay the full price. They're treating us like shit in American language, but it's the lab currently that we selected to do that. There was the old lab of Hal Huggins, who was a very good friend of mine. He was the dentist who set it up, and just to honor him and his creation, we've choose that lab. And so they do good work, but I think in terms of they seem to have absolutely no interest in the science behind it, and actually they just published a thing in the Townsend letter that was completely wrong. They're just going to say, just do a little bit of body work and then collect the urine, it will show up. Well, that's definitely not true. You have to do this right. And so, but it's a fantastic, simple test. And the good thing is the ultrasound is FDA approved, so there's nothing we use in there that will get people in trouble. And the PCR test has the highest level of acknowledgement in the scientific community. The PCR test looks for strains of DNA that are specific to a particular bug, and you only find the DNA of a bug if the bug is in the system. And the DNA doesn't linger around for weeks or months. So this is not that at some point you may have been exposed to it and now the dead bodies come out. This is these bodies were alive a few hours before, and so it's a test that gives you in real time what people have, and it's fantastic, and it's like everyone we've ever thought. Everyone who walks in here with an orthopedic condition is positive. Everyone who walks in with a neurological condition is positive. Everyone with brain fog and chronic fatigue is positive. And so the theory that all of this is Lyme disease is actually true.
Okay. Well, it makes sense to me to do the PCR test where you're finding the DNA of the bacteria as opposed to looking for that immune response that, like you said, is either not there because you've had it for so long and it's attacked your immune system, or, you could have already treated the infection. It could be gone. So you're dealing with what is there and instead of what feels like a guessing game sometimes.
Maybe I should say one last thing about that. Many of the Lyme literate physicians and leaders in the field have been very invested in the Western blot test and other immune system-based tests, or the culture test that Dr. Boroscano is involved in, and have been very reluctant to embrace my PCR-based testing because it's a bit like the pharmaceutical industry, when you're already invested in something and have built your whole practice around a certain kind of testing. We have not been welcomed by the rest of our medical community with this test, which clearly is a revolution in Lyme diagnosing and actually leading to much better treatments, because when you actually have a treatment where the PCR test turns negative, you're succeeding. And you have a treatment, where the Western blot test is disappearing. The patient either got a lot worse, or they may have gotten better, or the immune system may have gone to sleep. So you don't really know. The LTT ELISpot is a little bit more reliable in that way, but it's very, very difficult to know what you're treating by using the other conventional tests because they don't test for $14. It becomes not payable for people. And certainly to do follow-up every couple of months becomes impossible financially, just alone that, And
exactly.
The beautiful thing with our test is it's urine-based, so we can do it on newborn babies, we can do it on toddlers, on young children, we can do it on the whole autistic spectrum, because these kids, to take blood from them is akin to torture. At least for the physicians doing it or the nurses doing it. There's going to be screaming. You're going to have to hold them down with 6 people. And with the urine, it's not a big deal. Collect the urine and you can diagnose it off that beautifully. And they don't mind the ultrasound either. We can do the ultrasound on any autistic kid. By the way, all the autistic kids, have Lyme. So just to say it as a blanket statement.
We're going to talk about that more. I definitely want to talk about the other complications. We're going to take a quick break. We're talking today with Dr. Dietrich Klinghardt. He's been treating Lyme since the 1970s, and he's the founder of the Sophia Health Institute. We'll be back shortly.
Follow us on Twitter at VoiceAmericaTRN. Get the lowdown on guests, new shows, and your favorites. That's VoiceAmericaTRN.
You probably don't spend too much time talking about that place down there. Why not? There's now a show where that's mostly what we talk about and so much more. It's the Womb Happy Hour with host Lorraine Giordano. It's all about your body and the magical power you possess. Guys, you might want to tune in too. There's no reason to be squeamish. Listen for the Womb Happy Hour, broadcasting live every Wednesday at 6 p.m. Eastern Time and 3 p.m. Pacific Time on the Voice America Health and Wellness Channel.
Like many of us, do you feel constantly tired or run down? Weight gain, sugar addiction, stress, and other health issues wear down our bodies and our spirit. You can take control of these and get yourself back on track. Tune into Living Life Naturally with host Lynn Wadsworth. Lynn can help you lower or get rid of migraines, help you maintain a healthy weight, deal with hormone imbalances, and more. Listen live every Friday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness Channel.
There is a difference in health and wellness programs. There can be mainstream programs, and then there is something extra. That something extra is called Tips to Keep You Healthy, Happy, and Motivated with your host, Kristen Harper. If you want to hear some behind-the-scenes talk radio when it comes to health and wellness, the why as well as the how, be sure to tune in each week. This show will inspire you to be healthy and happy for life, as well as become the best version of yourself. Listen Tuesdays at 3 p.m. Pacific Time, 6 p.m. Eastern Time on Voice America Health and Wellness.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi everybody, welcome back. Today we're talking with Dr. Dietrich Klinghardt, and we're discussing chronic Lyme disease. So Dr. Klinghardt, before the break, you did mention that a lot of neurological illnesses, MS, ALS, Alzheimer's, Parkinson's, and autism are related to Lyme. And I know one of the complications, of course, is that our nervous system and our brains have a protective barrier, the blood-brain barrier. How do you get around that so that you can treat these infections once they've gotten in there?
Yeah, so that's, of course, with treating the central nervous system, that has been a challenge, even for the pharmaceutical industry, to develop drugs that cross the blood-brain barrier. And we use pretty exclusively herbs for this, for the purpose, and so we had to investigate which herbs tend to cross the blood-brain barrier, and then the published trick, to accomplish that with almost all the herbs is to make them into a liposomal preparation. Liposomal means that you have that herbal compound in the middle, and it's wrapped around it as a tiny microscopic bubble of an oil. So it looks on the outside like an oil, and on the inside it's watery. And so in this form, first of all, the absorption when you give kids or adults a liposomally prepared herb, it's absorbed into the lymphatic system, not into the absorptive veins in the gut. It's absorbed into, most of it is absorbed into the lymphatics and travels up the thoracic duct, and from there it goes into the venous system. So it already, on this pathway, it already cleans up one of the major structures in the lymphatic system, which is the thoracic duct, and then spills from there into the veins and then into the general circulation. And the uptake in the brain can be increased with different other methods, and the main one that we're using is the same one that we use for the testing, is a combination of ultrasound and infrared light. So we have a way of testing if supplements or herbs or antibiotics arrive in the brain or not. And that is not generally known, that very often there is a drug uptake problem in the brain, where the brain just won't take up medications that are aiming at killing the bugs that live in the brain. That was first discovered by Dr. Omura in New York, and so adopted from me. There's a technique that we have to check if a drug arrives in the brain. And based on that, we found that the most common issue that prevents the crossing of medicine that should cross the blood-brain barrier in the form that we deliver it, the most common obstacle why it's not taken up are infections in the jawbone, the so-called dreaded cavitations. And right next to it is root-filled teeth, and sometimes just simple metal crowns or devitalized teeth. But that's the most common issue. In children, the most common issue is chronically infected tonsils. They completely prevent the uptake of medicine into the brain. And to understand that, it's pretty simple. If there's a constant toxic stream coming from your mouth or your throat, the blood-brain barrier simply closes down. It closes business, because otherwise it would destroy the brain. And so, but that brain will have brain fog, because you get less oxygen, less perfusion, less nutrients entering the brain. Everything is less, and also the medication we put people on is less. And so what we found, what is uniformly very, very important, to clean up the mouth of patients and to clean up the tonsils in patients. Sometimes it's scars on the body, sometimes it's the thyroid that's dysfunctional, but I'd say 90% of the blockages of uptake in the brain of things that are prepared in a way that should be taken up. So the common blockages is either in the jawbone area or in the tonsils. And so we've developed a whole teaching of how to deal with that and where to go to get the help. Of course, we don't do dental work in my office anymore. So we send people to dentists that are highly skilled and highly trained in doing this right, because the Lyme patient is not an easy patient. As you know, they're usually more demanding than other patients, and more difficult and more reactive to if you do something that's imperfect. So we went through that over the last 20 years to find what dentists need to know. And dentistry is a fast evolving science right now, and so it's actually getting reasonably good at what it's doing. Where we still have trouble is if you need the tonsils taken out in a child, to have the ENT doc agree to that. A lot of the adults and kids, have a subset of symptoms that's called pandas or PANS. There's a blood test. It's called the Cunningham panel that most of our patients are positive. It shows that people have confused immune systems, but that's all affecting the blood-brain barrier. But so the trick that we're using is we're looking for obstacles for the uptake, and then we make the preparations, even the antibiotics, we make them liposomal, so they can cross the blood-brain barrier in that form. And then we use infrared light devices and ultrasound to actually temporarily open up the blood-brain barrier when we give something like we don't use conventional antibiotics. I like artesunate, which is a Nobel Prize-winning injectable extract of wormwood, and we use other things, even intravenous vitamin C, if you want to have that enter the brain. It's important that ultrasound and infrared light is used on the blood-brain barrier. There are certain spots on the skull where those things are applied, and that temporarily opens up the blood-brain barrier, and you get a much higher transfer of medicine into the brain. Of course, there's craniosacral therapy, there's certain lymphatic techniques, there is other ways of facilitating that, but it's a largely overlooked issue. One of the biggest issue is CCSVI, that's the chronic cerebrospinal venous insufficiency, that Lyme and especially rickettsia creates inflammatory changes in the veins in the anterior neck area. Those are the veins that drain the blood from the brain, and in response to that, the veins close down, they become narrow. And then what happens, if there's no blood going out of the brain, they can't go in the brain. And so most of our Lyme patients have a decreased perfusion of the brain, And then the important issue becomes a purely mechanical issue of how to open up the anterior neck veins, so to increase the blood flow to the brain. We had a couple of wonderful places in the U.S. that did that work. They all kind of went out of business because insurance wasn't paying it, and there was a general war between the hematologists and the blood vessel internists, the vascular people, and the neurologists. The neurologists were afraid that it was discovered with that many neurological diseases are actually vascular diseases, and they were losing their patients. So they just basically got rid of the procedure that opens up these veins. So we found different topical creams that actually deliver a vascular opening impulse to the anterior veins, and that works well, and that is sort of what we're doing. So this is different from the blood-brain barrier. This is the vascular issue. There's a few other issues, but the last thing I want to mention is that what's in the literature, the most healing agent for a defective blood-brain barrier that neither opens nor closes properly is progesterone. And so we temporarily in women, we use pretty high doses of bioidentical progesterone, not in order to fix the hormones, but to fix the blood-brain barrier. That's published, and it works beautiful. And in men, we have to be a little cautious with the dosage, but temporarily we do not hesitate to give men 25 milligrams or so of progesterone, and that has been hugely helpful to move the blood-brain barrier in the direction of healing. And the last thing about the blood-brain barrier is the blood-brain barrier is formed by the astrocytes. Those are the connective tissue cells on the inside of the brain that wrap their arms around or their hands around the blood vessels and prevent toxins from entering the brain. And unfortunately, the astrocytes are extremely, extremely sensitive to mercury and get destroyed by the smallest amount of mercury. And since now even the ambient air content of mercury has hugely gone up in the last decades, if people had silver amalgam fillings, which are really mercury amalgam fillings, they have a huge exposure to mercury vapor in the brain. And then, of course, there are several vaccines that still contain mercury, and all of that blocks and destroys the blood-brain barrier. And so detox of mercury should always be an integral part of making the blood-brain barrier functional. And this is pretty much a complete list of the obstacles why people are long-term on antibiotic therapy and need like 3 or 4 years to get any sense of improvement or never get there. We don't need that much, and we don't need antibiotics, because by eliminating those blockages, we can get beautiful results with liposomal herbs, and that's at least what I do, and it works for most people.
Well, I've had that same experience, and I didn't use antibiotics for my treatment, and I did get better. And I think that we have such a complicated illness and so many options available to us that we should be assessing all of them so that it can become less complicated.
Yeah.
We're going to take a quick break. We're talking today with Dr. Dietrich Klinghardt. He has been treating Lyme since the 1970s and is the founder of the Sophia Health Institute. We'll be back shortly.
Think you've seen everything there is to see in online television? Let us surprise you. Visit voiceamerica.tv today for sports, health, business, and more on demand 24/7.
Step by step, you made it through the journey of pregnancy. Now your baby is in your arms, and you're on the cusp of a new journey, breastfeeding. As a new parent, you receive a lot of advice, much of it conflicting, some of it outdated. Tune into Born to be Breastfed with host Marie Biancuzzo to bust through the myths about feeding your baby Marie and her guests will help you figure out what you can expect and put you on the best and surest path on your breastfeeding journey. Listen every Monday at 6 p.m. Eastern Time, 3 p.m. Pacific Time on the Voice America Health and Wellness Channel. Sometimes it just seems that nobody understands. There's one individual who can help. If you're living with somebody who faces challenges such as autism, Asperger's, or other exceptional needs, you'll want to tune into Solutions and Strategies with Dr. Sean, Living the Challenge. Together, we'll uncover a variety of solutions to the challenges faced by individuals, their families, and teachers. Listen live every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on Voice America Health and Wellness.
Addiction can affect our relationships, our families, our home, and work lives, but most importantly, ourselves. The recovery process can do wonders in the lives of people suffering from active addiction and also for those that love them. It's not just 12-step programs, but so much more. It's learning how to live life on life's terms. If you can relate to these issues or love someone who does, start with yourself. Start by tuning in to Miracles in Recovery with host Ray Lynch, Mondays at 8 p.m. Eastern Time, 5 p.m. Pacific Time on the Voice America Health and Wellness Channel. Hope is in your corner.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi everybody, welcome back to Falling Through the Cracks. Today we're talking with Dr. Dietrich Klinghardt. He is the founder of the Sophia Health Institute and has been treating Lyme neurological diseases and autoimmune disorders since the 1970s or for a very long time. So Dr. Klinghardt, with the complications of Lyme, I mean, we mentioned this when we talked about the testing that, you know, some people's immune systems aren't working or they're, you know, they get some autoimmunity. So how do we work on that so that we can get their immune system regulated?
Yeah, so it's important to know that pretty much all of us are in agreement that when we look at the volume of a patient's symptom and the variety of it, that over 90% of the symptoms in a patient are caused by the patient's immune response, and less than 10% are caused by the microbes and their activity in the system. That seems to be very, very clear. And so what our immune system does to Lyme, which is published, it mounts an ineffective immune response. And for example, we know that the outside surface markers of a Lyme spirochete look identical to the myelin of sheath of our nerves. And so the immune system, poor immune system, instead of attacking the Lyme spirochetes, attacks the myelin. And so you get all these neurological problems and MS. Depending on what surface markers Lyme and their friends, you know, the co-infections, what surface markers they're presenting, the immune system is not able to localize and identify these bugs and kill them, but it will attack any tissue in the body that looks similar, and that's your chronic pain, that's your brain fog, you know, that's inflammation in the brain. It's the bladder symptoms and kidney symptoms that people have. It's really every symptom, including the vascular illnesses that come from it, the immune reactions trying to kill the bugs that live inside the endothelium, rickettsia likes to live there. And so the immune system thrashes around and destroys many of the patient's tissues that look somewhat alike what they know the bugs may look like. That's one thing. But then also we know from Alan MacDonald's work that Lyme spirochetes actually live inside the vagus nerve. They live inside the several motor nerves until you get sciatica, and then what happens is that the immune system attacks the very nerves that we need, that are vital for us, attacks them and inflames them, looking for these bugs, but isn't able to mount an appropriate, successful immune response. And so many of us physicians, really under the guidance of the American Academy of Environmental Medicine, and especially the work of Ty Vincent, have realized that what the patient is suffering from is not the Lyme spirochetes or the Bartonella or the Babesia. What the patient comes to us for is the suffering that they have, and that's caused by the patient's own immune system. And we can down-regulate the immune system without destroying it and without using steroids, but basically using homeopathic doses of preparations made from the same microbes. That's sort of the low-dose immunotherapy. And I went sort of a step further. This is sort of probably the last thing I'm going to say. It's a beautiful new treatment that is 200 years old. 200 years old, there was a Russian general who he was also a homeopath. He was a friend and student of Hahnemann. And Napoleon went to war in Russia and lost 95% of his troops from a chronic infection that has been recently identified as was Bartonella quintana, a form of Bartonella. And on the Russian side, less than 5% of the troops died. And it's the anecdotal report how Korsakov dealt with that, with the infection, was fascinating. So he used a form of auto-urine therapy, he had basically created a dilution of the patient's urine. Every soldier had to basically pee in their jar in the morning, then rinse it out with water, succuss it, rinse it out one more time, and then drink it. And so that's called an LM potency in homeopathy. And I took that report serious. And so, a patient that is under treatment sheds a lot of Lyme spirochetes, Bartonella, breakdown products of Babesia in the urine. It comes out in the pee. And the general rule in homeopathy, if you have something toxic and you make a homeopathic preparation to it, it creates its own antitoxin. So we use the patient's urine, succuss it homeopathically in a certain way, and then that's what the patient drinks it several times a day. And those results are, in my experience so far, superseding the results of the low-dose immunotherapy, and I don't have to buy a single thing. Yes, all in the patient's urine comes out all naturally. The mercury is in there, the lead is in there, the glyphosate, all the toxins the patient has are trickling out and then making a homeopathic dilution of that antidotes that and accelerates the further excretion of those things. And that's wonderfully successful, simple, inexpensive, and I've been using that principle in my German following, Austrian and Swiss following, and I have an active license in England, so we've treated thousands of people that have absolutely no money just with that, with fantastic results. And so, but it's just modulating the immune system, and you can document that, the CD57 count goes up, their white blood count goes up, all the indicators that the immune system was down. You can see that there's very real, not just the psychological improvement, but there's very real improvement of the people at no cost. And I know there is many other approaches. Most of the herbs that we're using are also immune modulating. We use a lot of bowel bacteria, the megaspore biotic and the Bravo yogurt suppositories. That there's 42 different healthy microbes. They're all attempts to modulate the patient's immune system back to a healthy, functional system. And I know that that's the future of Lyme treatment, to do 90% of that. and maybe 10% of the killing. Yeah. So I think I'd like to leave it there.
Well, that's perfect. I think that's a lot of information and puts Lyme definitely in a nutshell for everybody. So hopefully that helps. Is there a way that people can get more information if they need it at all?
Yes, we have a couple of websites. The main one is klinghartinstitute.com, and the other one is sophiahealthinstitute.com. That's my practice. And then we have Klinghardt Academy. It's sort of a local teaching that more has to do with my ART testing. But either one of those three websites will provide people with a lot of guidance and things that they can, also DVDs, you can look at booklets and things. And I did write a book on the biological treatment of Lyme disease. It's out in Germany. It's been very, very successful and sought after. And we translated the book. We're just still suffering, trying to find somebody who wants to publish it here in the U.S. So if you know anybody, I'll be very grateful to hear.
Well, I look forward to reading that, so hopefully that falls into place for you soon so that we can all benefit. And I know whether people are a practitioner or a patient, attending your courses or even watching the DVDs are extremely helpful in understanding this illness and what you can do for yourself as well. And you have so much information. I think we could have probably talked for a week and not covered it all. So thank you so much for giving me an hour of your time today. I'm extremely honored that you joined me.
Well, it goes both ways. Thank you very much. And I actually have to go back to see patients. So thank you. And I hope good things come out of it. Yeah?
All right. Okay, thank you so much. Today we're talking with Dr. Dietrich Klinghardt. He's been treating Lyme for many, many years, and we benefited from some of his wisdom. I want to thank everybody for listening, and be sure to make today a great day. Thank you.
Thank you for tuning in to this week's edition of Falling Through the Cracks. Feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness channel. We'll talk more next week.